Good morning, everyone. This is Katie Novotny calling in from Premier Marketing. I want to thank you all for joining us this morning. We are excited again to be discussing the GTL product. This is going to be a home care product that comes with a lot of little bells and whistles. To start off, we're going to show you the video. It's a quick 2.5-minute video that will kind of show us about the product. And then I'm going to transfer the screen over to Liz, and she's going to take it away. So bear with me here. We're going to listen to the video, and we'll get us started.
Home. Home is a place where you build memories, the special times, the family routines, familiar friends, and familiar faces. It's the place that holds the things you love. And if you're like most, home is the place where you always want to live, now and far into your future. But achieving this dream means having a plan. It's estimated that 2/3 of Americans are going to need help with day-to-day tasks when they're aging at home. But this help comes at a cost, nearly $50,000 on average, which Medicare does not cover. This leaves families to fill in the gaps with their time, effort, and savings. Luckily, being prepared does not have to be difficult, not when you're a member of the Aging at Home Association. As an Aging at Home Association member, you'll get access to tools, resources, discounts, and special values to help you prepare for long-term aging at home. Plus, when you become a member, you'll have the option of including Home Care Secure as part of your membership. Home Care Secure is an innovative insurance product that provides weekly cash payments to help pay for home care and any other services you need when you need support to age at home. Then, when you and your doctor decide you need help to live at home and submit a plan of care, you'll receive a weekly cash payment drawn from your coverage amount for up to 50 weeks. Best of all, membership with Home Care Secure is affordable and available up to those age 74. For example, a $50,000 benefit would cost a 69-year-old female just $4 a day. It's simple to sign up, with just 5 enrollment questions and no medical exam required. Discover more about Home Care Secure by visiting our website. With Home Care Secure as part of your membership, you'll get peace of mind knowing you're better prepared to age in the place you truly want to be, your home.
Well, good morning, everyone. And Katie, thank you so much for the warm introductions. As Katie had mentioned, my name is Liz Christopher, and I'm joined today by my colleague, Nick Polish. And we are thrilled to be with you to introduce an innovative solution which combines insurance with navigation and advocacy resources. Now, you don't often associate insurance with innovation, but after today's presentation, we hope you come away with just that, a different way to think about insurance and a robust offering to enable your clients to realize their dream of aging at home as safely, as independently, and as long as possible. Now, before we get into the product details, I did want to provide you with some background and context on why we designed this solution offering. So all of our employees have either been a caregiver or have had to search for caregiver services for a family member or a loved one, as I'm sure many of you and many of your clients have had to do as well. We know the majority of people want to age at home now more so than ever. Yet the emotional and the financial burdens can be overwhelming, both to the individual and to their loved ones. In addition, the healthcare system is very disjointed and fragmented, especially within the short-term and long-term care spaces. And if you couple this with the misunderstandings and the misperceptions of what Medicare will cover, it's no wonder that there's a problem. Did you know that the average person will consume roughly $50,000 in unreimbursed healthcare expenditures in their lifetime, most of which is not budgeted or planned for? So this is a massive blind spot for so many, one which results in having to make difficult decisions, not only from where a loved one ages, but also to the quality and to the type of access to care that they're going to receive. And on a very somber note, these expenditures are the primary reason that individuals file for bankruptcy late in life. And so that's what brings us to Home Care Secure, our integrated solution, which combines an indemnity insurance product with navigational and advocacy supports to provide your clients with the tools, the resources, and financial security to age at home. At a very high level, the indemnity insurance product has available lifetime maximums ranging from $20,000 to $60,000 in $10,000 increments. The benefit's designed to pay over 50 weeks, thus leading to roughly payments in the range of $400 to $1,200. And because of the indemnity nature of the product, this money is paid directly to your client. If you move over to the right-hand side, you will see the Aging at Home Association provides a robust set of tools, resources, and discounts, which we've divided into three main areas. One, discounts and special values for frequently used goods and services, such as prescription drugs and vision. Care coordination services ranging from online self-service tools to help you make a plan, all the way to personalized care services by a dedicated advocate who's trained in elder care. And lastly, an annual well-being assessment that we developed in partnership with Fidelity Investments to take a holistic view of an individual in the areas of life, health, and money. So these elements all work together to educate your clients on the emotional, the social, the financial, and the operational components to be able to age at home. Now, before we take a deeper dive on the product, I did want to share results of some preliminary market research that we had conducted with one of the nation's largest retiree exchanges. So this chart illustrates that respondents placed an equal value on the association benefits of support, planning, and discounts on par with that of the cash indemnity benefit. So these respondents reinforced our hypothesis that Home Care Secure and the Aging at Home Association are highly valued on an individual basis. However, when you combine them, they represent a very powerful and very market differentiating solution. With that, I'll turn it over to Nick to provide details on the product.
Great, thank you, Liz, and good morning, everyone. So we're going to spend a couple of minutes on this slide, and I'm going to provide three things. First, address the three questions that are likely top of mind for all of you. How do I qualify my clients? What are the key product features I should be sharing with them? And then finally, how do they qualify for the weekly cash payments? So let's work our way left to right. So from an eligibility requirement perspective, there are two. First, your client must be age 50 through 74. And as you can see with the red text and the asterisk, we're proud to announce that effective April 1st, the eligibility age will be extended from 74 to 84. So for the balance of this month through March 31st, eligibility is age 50 through 74. Beginning on April 1st, it's age 50 through 84. So that's criteria one. Criteria two is that your client can pass the 5-question simplified underwriting process. And passing is the ability to answer no to each question. And you'll see in a few minutes that our health questions are very narrowly scoped, and we project that 85 to 90% or more of your clients will pass. Now focusing on the key product features. Similar to other products in this category, Home Care Secure utilizes entry age pricing and is guaranteed renewable. So the earlier your client purchases a policy, the lower the premium rates will be for the life of the policy. Liz mentioned earlier that there are 5 lifetime maximum benefit amounts available, $20,000 to $60,000 in $10,000 increments. And in order to have the policy keep pace with wage inflation, there are 2 mutually exclusive options, the inflation protection rider and the $10,000 buyout. So let me summarize the key components of each. First, the inflation protection rider. The purchase decision is made at policy issue. Secondly, it's a simple interest, 3% simple interest rate beginning in the 7th policy year. And then finally, there's no increase, or no limit, I should say, to the increase in the lifetime maximum while the policy is in force. So for example, if your client purchased a $50,000 policy with the inflation protection rider, after 30 years, that $50,000 maximum will have grown to $86,000. Now let's contrast that with the alternative, the $10,000 buy-up. So the buy-up is available every 3 years or more. However, it is subject to a lifetime maximum benefit of $60,000. So to continue my example with the inflation rider, if your client had a $50,000 lifetime maximum, they would only be able to buy up one time because then they would be at the $60,000 cap. Now, you'll note that the lifetime benefit grades over a 5-year period. It starts with 10% in year 1, the first day of the first policy year, 20% on the first day of the second policy year, and so on. And beginning in the 6th and subsequent policy years, the benefit is the lifetime maximum is fully vested. So what was the rationale behind offering this feature? First, it allowed for the simplified underwriting. Secondly, it allowed for competitive rates. And then third, while none of us can predict our healthcare future, individuals generally purchase these type of policies 5 to 15 years or more before they anticipate needing the cash payments. And so in these situations, the gradient schedule is effectively not applicable. And then finally, the multi-episode of care. So the headline here is that Home Care Secure can be used episodically over a period of time. And that period of time could be measured in months, years, or decades. One episode of care ends when your client recovers and does not need home health care for a minimum of just 30 days. So then that leads to the next logical question in the last column: how does an episode of care begin? So there's essentially 3 requirements. First, a licensed healthcare provider, and it's important to note, while that licensed healthcare provider can be a physician, it doesn't have to be. It could also be a registered nurse or a licensed social worker. One of those healthcare professionals must certify that your client suffers from a physical or cognitive impairment. A physical impairment is the inability to perform 2 or more of the activities of daily living. A cognitive impairment is a diagnosis of dementia, for example. The second qualification is that your client needs home health care at least 3 times a week, and each visit is at least 1 hour in duration. And then finally, all of this must be documented in a plan of care. And given the indemnity model, the cash payments are paid directly to your client without regard to other insurance coverage. And quite likely, the amount of the weekly cash payments will be greater than the value of, or the cost, I should say, of the home health care being rendered. And we have seen situations where clients have used those excess funds to perhaps compensate uncompensated care from families or neighbors, perhaps to cover and pay for home modifications or other healthcare needs. And frankly, the money can be used for anything that your client needs at their discretion. So let's take a quick look at the underwriting questions. So as you're all skimming the questions, let me leave you with some thoughts. First, the process is simple. It yields real-time determinations at the point of application and is easily attainable. Note that the questions are very narrowly written in that they don't embody a lot of health conditions within each question. And as I indicated earlier, we project that 85 to 90% or more of your clients will qualify. So at this point, I'm going to send it back over to Liz, who will discuss and provide an overview of the benefits and services of the Aging at Home Association.
Great, thanks, Nick. So now that we've reviewed the insurance component of our offering, I would like to take a few minutes and focus on the association construct and the benefits. So as we've highlighted, we were very purposeful in the design of both the product and the association. Since we've been in this position ourselves, either being a caregiver or having to seek or search for caregiver services, we know how overwhelming the process can be. And in addition, our vast experience in the insurance industry, we have seen far too often that people don't learn about their insurance. They don't understand their benefits or what coverage they're entitled to until they're sick and at their most vulnerable. Thus, they're usually not equipped to make the best decisions. So therefore, we wanted to bring together the tools, the resources, and the navigational supports to help individuals and their caregivers in advance of their time of need, so they have increased peace of mind Now, as many of you are aware, since Medicare does not cover expenses related to hearing, dental, and vision, and even if an individual does have prescription drug coverage, huge gaps still exist. Therefore, we wanted to ensure that our association provided these valuable benefits and discounts. So just to share a few examples, we offer free unlimited telehealth through our partnership with MD Live. Individuals can experience discounts of up to 50% on dental and vision services and hardware, and up to 85% discounts on prescription brand name drugs through our coverage with FairScript. All of these provide real value immediately to your clients, and on average, an individual can realize over $500 in annual savings. One of the benefits, though, which truly differentiates us, involves our unique partnership with Wealthy, which provides care coordination services, and Nick actually has a personal story on this front that he would like to share.
Thank you, Liz. So my story is probably not going to be too dissimilar from experiences that many of you, your families, and your clients have had. But several years ago, my dad passed away, and my mother made it very clear that it was her intention to continue to live in the home that she raised her family. But over time, she became increasingly socially isolated. She was exhibiting memory loss and frankly was clinically depressed, and something needed to be done. And like many families, I live several hundred miles away from where I grew up and have been out of the community for decades. And thankfully, I had Wealthy to turn to. So I was paired with a care coordinator, and my care coordinator is an individual with a master's in social work with a focus on elder care. And we had a couple of conversations where I brought her up to date on the situation and what we were trying to accomplish. And out of that, she created an integrated care coordination program that had three components to it. The first one was addressing, the immediate need. She identified resources in the community that allowed my mother to continue to safely live. Secondly, recognizing the trajectory of her health, she researched and vetted within a 25-mile radius of where my mom lived, assisted living facilities and nursing homes, and particularly with a focus on those that had memory loss units. And then finally, she researched and identified a financial aid program run by the Veterans Administration with which my mom was eligible. So because of these efforts, my mother was able to live at home safely for an additional 2.5 years and is currently a very happy resident at one of the vetted assisted living facilities. And I often think, what would have happened if I did not have Wealthy to rely on? And these are the things that I think about. First, there would have been much anxiety and sleepless nights. Secondly, undoubtedly, we would have made mistakes. And then finally, my mom wouldn't have lived in her home as long as she did. So I hope this experience, brings to life the value that Wealthy and its care coordination services can bring to your clients in their time of need.
Great, thanks, Nick. So with the insurance and the association, what does all of this mean? So let's meet Retiring Ray, which is a persona that we created to bring these elements together and help make them real. So Ray purchased the $50,000 policy with the inflation rider when he was 65 at a monthly premium of $109.57. Now, we were very particular about selecting this level of coverage as our example, because if you recall earlier, I mentioned that the averaged unreimbursed out-of-pocket expenses are roughly $50,000. And this is an expense that 2/3 of us will encounter in our lifetime. At the age of 80, unfortunately, Ray requires in-home custodial care and needs to go on claim. Now, by this point, Ray has made monthly payments in the amount of $19,700, but if you look, Ray has an available maximum benefit of $63,500, which reflects the $50,000 policy plus the inflation rider, translating into payments of $1,270 every week for up to 50 weeks. And since Ray has been a client for 15 years, He's been taking his annual assessments. He's been leveraging the available tools and resources. Ray and his family have been having these discussions. They understand his wants and his desires, and they know what to expect from a benefit perspective. They've worked together, they've put together an aging in place plan. So now the family just has to execute on that plan versus scrambling at the last minute, trying to educate themselves and making snap decisions because they're either short on cash or on time. So with that, we'll turn it back over to Nick to close us out.
Great, thank you, Liz. So we respectfully believe that Home Care Secure is the home healthcare solution that you should present to your clients. As we surveyed the landscape and compared Home Care Secure to available alternatives, we identified 4 key areas of differentiation. First, product complexity. So let's talk about behavioral economics for a moment. Numerous studies over the years have concluded the same thing. Too much choice leads to consumer confusion and reduced sales. And so with that in mind, Home Care Secure was designed to be easy for clients to understand and therefore easy for you to explain. There's literally 2 decisions that a client needs to be make. What lifetime maximum benefit? And there's 5 choices. And do I want the inflation protection rider? Yes or no? So 2 decisions, 7 choice variables. Other solutions in the market require up to 7 separate decisions and in excess of 60 choice variables. The underwriting process. Home Care Secure's process is simple, an immediate determination at the point of application with high acceptance rates. Contrast that with policies in the market that require both knockout questions and/or medical underwriting. The knockout questions are generally broader in scope, and there are more of them. Secondly, gathering several years of medical and pharmacy data is inconvenient for your clients. It takes the carrier time to consider the information, and then at the end of the process, it yields lower acceptance rates. Third, from a claim qualification perspective, as I mentioned earlier, Home Care Secure requires that a licensed healthcare professional, which could be a physician, registered nurse, or licensed social worker, certifies that your client cannot perform 2 or more of the ADLs or suffers from a cognitive impairment. Other products use the medical necessity standard, and that can only be attested to by a physician. It's more subjective in nature and in general represents a higher standard for clients to meet. And then finally, the availability of the Aging at Home Association. As you recall, we established earlier that these policies will generally be enforced 5 to 15 years or more before the cash benefit's needed. With Home Care Secure, membership in the Aging at Home Association provides immediate and ongoing value to your clients with its free unlimited telehealth visits, discounts of 50 to 85% on health services, and other related features such as the care coordination through Wealthy. So as you compare annual premiums, you'll factor into the equation that the association can deliver to your clients up to several $100s of cost avoidance each year. This is effectively a direct reduction in premium costs. And then finally, we believe that these immediate and ongoing benefits of the Aging at Home Association will serve to increase policy persistency and keep those renewal commissions coming. So let's talk about the opportunity. Why should you introduce your clients to Home Care Secure? Well, there's opportunities for your clients and for each of you. Each of you are trusted business advisors to your clients. So here's an opportunity to reinforce that position by educating them on a potential gap in their financial plan and introducing them to a solution to protect their future and give them peace of mind. We realize that your time is your most precious resource. Thus, we designed Home Care Secure to be easy for your clients to understand, affordable, experience high acceptance rates, and save time with an efficient enrollment process, which takes 10 to 15 minutes to complete. So let's talk about resources and support. All of us at Home Care Genie, Premier, and GTL are laser focused on your success. We've developed a number of client-facing materials, such as the explainer video and product brochure and other marketing assets to assist your efforts. As well, we're fully leveraging GTL's technology platform, including eApp, which is the online enrollment and quoting and enrollment tool, and GT Link, which is the agent portal. Finally, as you introduce Home Care Secure to your clients, we look forward to your suggestions as to how we may better serve you. So what's next? If you're already appointed to a GTL, congratulations, you're ready to start representing Home Care Secure to your clients. If you're not currently appointed to GTL, here's Katie's contact information, and if you let her know, she and her team will send you the appropriate materials to get you contracted with GTL and out in the market. So with that, that concludes our prepared remarks. On behalf of Liz, we thank you for your participation today, and we look forward to addressing any questions you might have. I'll turn it back to you, Katie.
Thank you both very much. As always, if anyone has any questions, please feel free to type them in now. A couple questions have come up, and one is, are the rates level or do you age into the next rate?
Yeah, the rates are level. So utilizing entry age pricing, the rate you have, you will keep for the life of the policy. Now, there is one caveat to that. So if someone purchased a policy and elected not to purchase the inflation protection rider, but at some point in the future wanted to increase, take advantage of the $10,000 buy-up, their new rate would be based on the new lifetime maximum as well as the age at the time of the buy-up. But for someone who purchased a policy with the inflation protection rider, their rate will not change for the life of the policy.
Perfect. Another one is regarding the video. Is that consumer approved or is that just producer approved?
It is consumer approved, and we actually have two versions. We have one version, the version you saw today, which is a little over 2 minutes, and then we have another version that's a little over 3 minutes. Both are approved for consumer use. And just as a coming attraction, we're developing a third video that's going to be a bit longer and go into a little more depth on the care coordination services through Wealthy. And that particular video will be for agent use only as a training vehicle.
Great. I'm getting a couple comments asking about presentation being emailed. Yes. As for signing up with this, we will be sending out some videos, some marketing pieces, and also a copy of this presentation to anyone that has registered. One last question I see, and please feel free if anyone else has anything in the meantime, but another question is these benefits, can they be used by family members, or is this just a benefit for the insured?
It's a benefit for the insured. However, just as a little nuanced response to the question, for example, I could buy a policy on behalf of my mother, let's say. However, I would have to use the state of health of my mother in answering the knockout questions, and my mother would be the one that would have to qualify, meeting the ADL requirement and having the home care services provided by licensed home health care providers and so on. I don't know if I answered that individual's question or I made it, I confused them.
Absolutely.
But, okay. But if that person if you have a follow-up, I'd be happy to address that. So if I didn't answer your question.
And Nick, I think the one nuance to that as well is you had the Wealthy services available to you, but were able to utilize them for your mother as well. So from that
right.
perspective.
That's right.
So with
and
some of the,
well, go ahead, Liz.
I was going to say with some of the discounts and values and benefits available through the Aging at Home Association, they are available to the insured as well as to other family members as well, that you can utilize your benefits to assist them.
I'm getting a follow-up here. Specifically, this person is looking at the teledoc visit.
Yes, so those services with the relationship we have with MD Live, those services would be eligible for the individual, for the insured, and for their family members.
Perfect. One more question came in, and it says, I see the use of a four-pronged cane is a knockout question. How about a straight cane?
I'm a literal person, and so I would say that that's permissible.
Perfect. Another one that just came in. How many times can a client use this service if used once, but they get back on their feet?
So it can be used multiple times. So, think about, like, the episode of care. And so, again, you qualify, from needing assistance with 2 or more activities of daily living, for example. So let's say you meet that qualification, and then you recover. Well, and then you might, 30 days later, you could have another episode. So here's an example. Here's an example of someone who, well, first of all, this is the multi-episode of care example, which also provides some example on the impact of the grading schedule. So the general rules are up on the top. So let me kind of go through them, then I'll show you them in practice. So first, you determine the available lifetime maximum benefit and not consider what's been paid to date. And you'll see why this is to the benefit of your client. Secondly, we divide that figure by 50 because, as we indicated earlier, the benefit is intended to pay over a 50-week period, and then that amount would be paid up to the policy lifetime maximum benefit. So let's take an example where an individual who purchased a $50,000 lifetime maximum benefit had 3 claims over a 6-year period. So the first claim they had in year 1. So year 1 is in the vesting period, and it's 10%. So they have available to them in that first year $5,000, 10% of 50,000. Again, because it's intended to pay over 50 weeks, the weekly cash benefit is $100. And for the sake of this example, we said, let's assume that the claim was approved for 25 weeks. So for this particular claim, the policy would pay $2,500. So now that person recovered. Now they suffered another claim in the 3rd year. So now in the 3rd year, the policy is at the 40% graded level. So they have $20,000 available to them. And notice we're not decreasing the $20,000 by the $2,500 that's been paid to date. So what is the available lifetime maximum benefit without considering what's been paid to date? So it's $20,000. Again, paid over a 50-week period is a weekly benefit of $400. In this example, we said, let's assume this claim was approved for 30 weeks. So now for the second claim, the policy paid $12,000, 400 times 30. And collectively, in the aggregate, the policies paid $14,500. Fast forward 3 years later, the same individual had another claim. Well, now they're in the 6th year, and the benefit's fully graded. So they have full access to the $50,000. Paid over 50 weeks, that's $1,000 a week. This claim was approved for 40 weeks. But what's going to happen in practice is that the individual is going to receive $1,000 for 35 weeks, and then in the 36th week, they're going to receive $500, and then payments would end because they will have exhausted the $50,000 lifetime maximum. So I hope that helps explain how the plan works, or how the payout could work over a period of time, and also provide some illustration of the impact of the grading schedule.
Perfect. Another question is this in Connecticut?
Unfortunately, not at this time. Let's take a look at the map of the United States. So currently we're available in the 17 green states, and the 8 states that are shaded blue. The filing process will begin this month, and those states will become available throughout 2021 as we work with the state insurance departments. But certainly by the end of the calendar year, we would expect to be in 25 states. We're in 17 states currently.
Perfect. Another question is there a waiting period for the benefits to begin?
There is not. So literally, when your client purchases a policy, they will receive the policy within minutes, and technically the benefit, again, first year 10% graded, 10% of the purchase lifetime maximum benefit is available from the first moment that the policy is issued.
Gotcha. And then the follow-up is so to get this straight, year one, the client or the applicant only has 10% of their benefits.
That's correct. And in 20% in year 2, 40% in year 3, 60% in year 4, 80% in year 5, and then beginning with the 6th and subsequent year, they have 100%.
Okay, perfect. Another question: does the membership put off potential clients? Ken, if you can expand on that. If there's a membership component put off potential clients?
Well, we haven't experienced that. That's not feedback that we've received. So the premiums that the monthly premiums that your clients will pay for Home Care Secure include both the insurance premium for the insurance product and then the association fee for the Aging at Home Association, which is $9.99 a month. And as Liz pointed out, there's so many advantages and programs and discounts available to members of the association that we think from an economic payback perspective that it's that it benefits everyone who's part of it. So we haven't received that feedback to date.
Another question is the policy issued based on residence state or the state in where the application is signed? In other words, if someone lives in Florida but they come to Ohio and signs an application in Ohio and on an Ohio app, can they offer the policy?
I don't know the answer to that question off the top of my head. So if thank you for asking that question, and if we could follow up on that response. I don't want to give misinformation. I'd rather ask.
Well, I would be 98%, probably 99% confident in telling you that they are going to go by resident state as the other GTL products are. We do, however, have a short-term care company that does use Citus State. So we will follow up with you with a definite on that and be back in touch. One more here is, if in year one, or if you purchase $50,000 benefit, you can only receive $100 a week max in year one?
That's correct.
Okay.
And again, it's because 10% of the benefit is vested. So 10% of 50,000 is 5,000, and the benefit is intended to be paid out over a 50-week period. So 5,000 divided by 50 is $100, and that's the derivation of the number.
Perfect. Well, I think we've covered everything. And again, I want to thank everyone for joining us this morning. A nice sized group out there. And if there's questions that come up, you will all be receiving the copy of the marketing materials and the presentation. So feel free, if there's additional questions, reach out. Mandy and I would be happy to walk you through how this works. And if we don't have an answer, I'm sure that Liz and Nick would be happy to get on a phone call with us. So that being said, Nick and Liz, as always, I appreciate it. Thank you very much. And to all of you out there, happy selling. And we will be in touch soon. Everybody have a great day.
Sounds good. Thank you.